Carpal tunnel syndrome. The anatomy is a narrow passageway in the wrist. The roof consists of the transverse carpal ligament and the floor consists of the carpal bones. The carpal tunnel protects the median nerve and the flexor tendons of the fingers and thumb. The pathology is hypertrophy or edema of the common synovial sheath that covers the flexor tendons in the hand. The mechanism of injury is compression and traction of the median nerve, repetitive forceful hand movements, mainly wrist flexion, and some of these common activities are typing, playing video games, excessive phone use. Sometimes some non-technology use would be sewing, just anything that really works the fingers a lot. And another mechanism can be a direct blow that pinches the median nerve entirely. Signs and symptoms include numbness and tingling in the thumb and the second through fourth fingers. There could be pain and burning that travels up the arm. There will be wrist pain at night that can possibly make it hard to sleep. And there will be weakness in the hand, which leads to a weak grip. Differential diagnosis is a cervical radiculopathy with the C6 and 7 nerve roots, brachial plexus, median neuropathy, fibromyalgia, ligament sprain, or forearm compartment syndrome. The special tests include the Phalen's test, which in the top picture that demonstrates exactly how the Phalen's test is performed. You put the dorsal sides of both your hands together and you can basically just balance out your elbows. The Tinel sign, you basically just tap where the median nerve runs through the wrist. Another example of the Tinel sign is basically tapping the entire median nerve all the way up from the tip of the fingers to the elbow. And the last special test is a compression test where you just compress or squeeze down on the median nerve and see if you can't cause that numbness and tingling feeling to happen. Predisposing factors include diabetes, high blood pressure, arthritis, smoking, a high BMI, previous wrist injuries, or occupations where you do a lot of typing or a lot of small little finger hand movements. Management and treatment. Take frequent breaks from stressful activities. Like if you type all the time, just take common little breaks throughout your day and avoid those activities altogether if possible. You can ice it to reduce the swelling, put it in a wrist splint overnight, mainly to help with sleeping. NSAIDs, corticosteroid injections, and if all else fails, you can get an endoscopic or open surgery to relieve the pressure. Referral, you could send them to an orthopedic for the corticosteroid injections, and you get fitted for a proper splint. And again, if need be, you can get surgery to relieve that pressure. Prevention would be sleeping with wrists held straight, straight wrists when working, avoid repetitive wrist flexion, and frequent breaks from repetitive wrist flexing activities, and stretching exercises of the wrist. To the right is a chart of many different exercises to relieve carpal tunnel and the proper ways to use mouse and keyboard to prevent that repetitive flexion. A mulligan technique is the transverse ligament release, where the picture basically shows it all. You grab those ends of the hand and just pull away to relieve the pressure that builds up at the carpal tunnel. My PICOT analysis. The population was 104 patients with carpal tunnel syndrome. The intervention was all patients received a type of surgery to release the tension of their carpal tunnel. The comparison, 54 patients were treated with endoscopic carpal tunnel release surgery, while the other 50 were treated with open carpal tunnel release surgery. The outcome was that the patients that received the open carpal tunnel release surgery returned to work and were able to perform their regular daily life activities significantly faster than those that were treated with the endoscopic carpal tunnel release surgery. And the time frame of this was about 2 years. And these are my references.